Okay, we're going to be using the PICOWave Nutritus machine for this service. And if you can video, we're going to turn the machine on in the back. We're going to actually go to the automatic mode. And we're going to go to Auto Sculpt. We hold it down for 2 seconds and it changes color. It's like a turquoise color. We have our probes plugged in and we're going to start the treatment. I'm going to add a little bit more gel. And we always make sure that we have the red probe on the bottom and the black probe on the top. And the motion that we're going for is we are actually lifting and holding. We hold on a count from 4 to 6. With our younger clients, 4 counts is enough. With our older clients, we definitely want to hold 6. We're bringing it up and holding. Once again, the lift, and I'm using a little pressure and holding. The machine signals that it's going into another program, which is just fine. We're working on a little lift for the brow. Are you feeling the current?
Yes.
Okay.
On the top one more
okay.
so.
We're going to turn it up. I had her at 28. I'm going to go to about 34. I'm going to go again. Lift. You see a little twitch there, so I'm going to turn it back down. About 28. Hold. Holding. One more pass on that side. Hold. Hold. Okay, we're going to move to the other side. We can already start to see the brow is lifting. Use a little pressure and hold. The area that the client might feel the current the most would be the forehead, because that's the area that's thinner, not the padding on the forehead like we have on the cheek area. Lift. Hold. And hold. One more time. Lift. And again, we're keeping the red on the bottom, the black on the top. We're going to work on the nose and kind of the middle area. Microcurrent is great for minimizing pores. Just going to work around the mouth a little bit. Clients could be a little sensitive around the mouth area. If they are, you can turn the intensity down. Also, a client could use a mouth guard. I'm working the nose. It helps with pores as well as kind of tightening up the nose. I'm going to work the upper eye lid. The under eye area. I'm actually going to do a little lip plumping, so I'm going to put a little of the gel on the lip area, and if you'll open your mouth just a little bit, we're just going to plump the lips. And I take the intensity down to about 20. The black is on the top, the red on the bottom, and you can really see it's almost like a magnet that pulls the lip. We lose volume in our lips, and this process can really make a difference, especially when the client is getting a series of treatments. The lower lip. And what this feels like is just a little tingling. It's very invigorating to the lips and helps the condition of the lip. You want to make sure that your client is very hydrated prior to treatment and after. We're going to use the gloves so you get to see the action with the gloves. These are the gloves. They're snapped, and we're going to insert into the quad cable area. We're going to wear the insulated gloves so that the current will go to the client and not to me. Gloves can be used on the client without the inserted gloves to actually give a hand treatment. And microcurrent on the hands is really a good treatment. The machine signaled off, so we're going to now move the machine to auto build, and I'm going to hold it down to turn it on. you are hearing clicks. I'm turning the machine up to 70, anywhere from 70 to 80. The client is going to, you want to tell the client that they'll probably have a metal taste, and that's because the taste buds are recognizing the current. And when I work around the cheek area, the client is probably going to see a flash of light, and that's the optical nerve recognizing the current. Nothing to be alarmed about, but it's important to let the client know. My gloves are wet, and I can re-wet them with the machine plugged in. It won't cause a problem. And I'm going to do the very same technique that I did with the probes. It's a lift and a hold. And you might see just a little bit of a twitch with this program, which is fine for this program. Every time the click is going on the machine, the current is actually going into the body with that sequence. It'll be very fast, and then it'll slow down and be a medium speed, and then it will go very slow. And it's just like working out in the gym. We change up our exercise with our muscles, and that's basically what we're doing with the way the signatures are going into the skin. We're going back to the neck. I've had great results of lift with the neck using the gloves, and particularly on this program. This program is especially good for lift with neck, with lower face, above the brow area. And my gloves are close together. They're always on the same side, but they're not touching, because when you touch, then you actually cancel the current. Clients like the gloves. They feel very therapeutic, like massage, and the current is a nice smooth feel with the gloves. And you can cover a lot of surface area with the gloves and really grasp up under the muscle. I'm putting a little pressure, which feels good with the current. Okay, I've done 3 passes. I'm going to go the other side. And again, we don't need gel for this process. We just need to have the gloves wet.
Shit, sorry. I'm so sorry. I'm so sorry.
Might want to back away a little, go a little up. You might be able to see the gloves better.
Yeah.
Some estheticians find it more comfortable to stand and do treatments, and others choose to sit, and sometimes we do both. You just need to do what works for you. You can hear the clicks of the machine are going fast again. You want to think in terms of sculpting the face. We're going to move to the photon probe. This is the photon probe. And it's going to be plugged in to this, it's where it says sonic probe. And I'm going to take the system to tone. That's one of my favorite programs. Manually, I'm going to use this program. You could do automatic sculpt if you wanted to. I push it down for 2 seconds. It comes on. Now I have one probe and I need another one to balance it, which would be my red. So I'm going to plug the red in. And at this point, I could penetrate a product. I could penetrate a mask. This sonic probe is particularly good for under the eye puffiness, under eye puffiness that clients have, eye bags. The way we turn it on is first here. Then if I want to use the red light or any of the lights, I've got blue, I've got red, I've got green. I'm going to go for the red. And then I'm going to put it on high for the sonic activity right here, and you can drop a little water and watch it beat up, and that lets you know that that sonic system is working. And the three systems together, the sonic, the microcurrent, and the LED, are extremely effective. Anytime you layer modalities, you're going to get more out of each one of them. And of course, I'm penetrating Zen therapy, and like Tasha said, it's one of those golden products that is full of peptides. It's going to be very nourishing to the skin, and you can just use a circular motion. And this is a very soothing treatment for the client. Feels good. There's no warmth to this, but she does feel the microcurrent. She feels the sonic, and of course the LED is going to penetrate, help in product penetration as well. You can go right over the lips. And this doesn't have to be a long process. You can do it very quickly. Anytime you do have fine lines, which this client does not, but many of our clients do, I really like to use this photon probe to iron out issues with fine lines. Okay, you've seen all the modalities.